The muscle body is encased in which of the following? A. The perimesum. B. The epimesum. C. The endomesum. D. None of these. The answer is B. The epimesum. The muscle body is encased in a fibrous elastic sheath called the epimesum, epi meaning on or above and mes meaning muscle. It is composed of dense irregular connective tissue and is continuous with tendon fibers. The perimesum surrounds muscle fascicles, while the endomesum surrounds muscle fibers. Which of the following correctly describes an isometric muscle contraction? A. The amount of muscle tension increases without any change in the length of the muscle or the angle of the joint. B. This form of contraction can either be eccentric or concentric. C. There is a rapid burst of mechanical energy for a short powerful movement. D. The length of the muscle shortens and the angle of the joint changes during the contraction. The answer is A. The amount of muscle tension increases without any change in the length of the muscle or the angle of the joint. Isometric muscle contraction are those in which the tension in the muscle increases, but the muscle does not change length, nor does the angle of the joint change. An example would be attempting to push or lift an object that is too heavy to move. This is in contrast to isotonic contraction, in which muscle tension remains constant, but the muscle length and joint angle both change. During contraction, the A band of the sarcomere does which of the following? A. It lengthens. B. It thickens. C. It does not change. D. It shortens. The answer is C. It does not change. The A band in the sarcomere is created by the bipolar myosin filaments, joined at the M band. During contraction, the heads of the myosin filaments bind with the actin filament and pull it toward the M band at the center of the sarcomere. The myosin filaments do not themselves change length, and because of that the width of the A band does not change during contraction. In the sliding filament theory of muscle contraction, all but which of the following are functions of ATP? A. ATP does all of these things during muscle contraction. B. It moves the myosin head into a high-energy cocked position. C. It allows the myosin head to detach from the actin filament. D. It moves tropomyosin off of actin binding sites. The answer is D. It moves tropomyosin off of actin binding sites. According to the sliding filament theory of muscle contraction, ATP binds to the myosin head and is hydrolyzed to ADP and inorganic phosphate. The energy released during this change draws the myosin head back into a high-energy state, from which it is able to bind with actin and execute its power stroke, leading to muscle contraction. ADP and inorganic phosphate then are released from the myosin head and replaced by a new molecule of ATP, which allows the myosin head to detach from the actin binding site. All of the following features are unique to cardiac muscle cells except A. They form branching chains. B. They are linked together via intercalated discs. C. They are non-striated. D. There are gap junctions between cells. The answer is C. They are non-striated. Cardiac muscle cells are striated, branching cells that are linked by structures called intercalated discs. These discs are composed of gap junctions, which allow the free passage of electrical signaling between heart cells, and very strong attachment points called desmosomes. A nurse is examining a patient who has muscle pain and fatigue after working out. He determines that the patient has muscle strain. This is generally caused by which of the following? A. There is damage to ligamentous attachments. B. Excessive contraction causes tetany in the muscle body. C. Hypertrophy is causing swelling of the muscle fiber. D. The actin and myosin filaments have been pulled past their ability to overlap. The answer is D. The actin and myosin filaments have been pulled past their ability to overlap. Muscle strain is often caused by overstretching, during which actin and myosin heads are pulled to the extent that they are no longer overlapping, possibly to the point of causing tears in muscle tissue. Tears in ligaments are sprains, rather than strains. Which is the only muscle type that is non-striated? A. Skeletal muscle. B. Cardiac muscle. C. Smooth muscle. D. Voluntary. The answer is C. Smooth muscle. The only type of muscle that is not striated is smooth muscle. Smooth muscle does not use sarcomeres for contraction, rather, each muscle cell is a spindle that is covered in a mesh of contractile fibrils. These fibrils contract in unison when calcium enters the cell. Which of the following is the smallest unit of contractile tissue in cardiac and skeletal muscle cells? A. The sarcomere. B. Actin filaments. C. The myofibril. D. Myosin filament. The answer is A. The sarcomere. The smallest contractile unit in muscle tissue is the sarcomere. Myofibrils are made up of many sarcomeres attached end-to-end at a series of dark lines, hence the term striated, called Z-lines. Each sarcomere contains actin and myosin filaments, which pull together during contraction to shorten the sarcomere. The sliding filament theory of muscle contraction involves the dash attaching to dash and then pulling during the power stroke. A. Myosin. Tropomyosin. B. Myosin head. Actin. C. Actin head. Myosin. D. Troponin. Actin. The answer is B. Myosin head. Actin. The sliding filament theory of muscle contraction involves the myosin head attaching to actin and then pulling during the power stroke. Troponin is a protein attached to tropomyosin, a thin strand wrapping around the actin filament. When calcium enters the cell, troponin moves toward it, pulling the tropomyosin strand away from actin binding sites and allowing the myosin head to bind. Which of the following molecules binds to troponin during muscle contraction? triggering tropomyosin to move away from the actin binding sites and allowing the myosin head to form a cross bridge. A. ADP. B. ATP. C. Sodium. D. Calcium. The answer is D. Calcium. During a muscle cell action potential, calcium enters the cell via T-tubules, which are specialized invaginations of the sarcoplasmic reticulum. Calcium binds with troponin, which pulls the tropomyosin strand away from actin binding sites and allows myosin heads to bind. Neither sodium nor potassium bind to troponin, and ATP and ADP both bind to myosin, rather than troponin. Which of the following is the name of the modified endoplasmic reticulum found in muscle cells? A. The sarcomere. B. The myoplasmic reticulum. C. The T-tubule. D. The sarcoplasmic reticulum. The answer is D. The sarcoplasmic reticulum. Muscle cells have a specialized endoplasmic reticulum called the sarcoplasmic reticulum. The sarcoplasmic reticulum regulates the calcium ion concentration in the cytoplasm of striated muscle cells, and so plays a significant role in muscle contraction and relaxation. The T-tubule is a specialized invagination of the sarcoplasmic reticulum, and the sarcomere is the single contractile unit of a muscle fibril. There is no muscle structure called the mycoplasmic reticulum. The articulation between the intervertebral disc is what type of joint? A. Synovial. B. Synarthrotic. C. Cartilaginous. D. Diarthrotic. The answer is C. Cartilaginous. The intervertebral disc articulate with the vertebrae via cartilaginous symphysis joints. These joints are amphiarthrotic, meaning that they allow for slight mobility. Synovial joints are all diarthrotic and characterized by a flexible joint capsule filled with synovial fluid. Synarthrotic joints have no movement. Examples include the skull bones and the joints of the teeth to the jaw. The head of the femur articulates with what structure of the hip joint? A. The obturator foramen. B. The glenoid fossa. C. The acetabulum. D. The patella. The answer is C. The acetabulum. The head of the femur articulates with the acetabulum, a concave surface on the pelvis formed by the union of three bones, the ilium, the ischium, and the pubis. The obturator foramen is a large opening in the pelvis formed by the pubis and the ischium bilaterally. It does not form any joints but rather allows the passage of the obturator artery, nerve, and vein. The glenoid fossa is the surface onto which the head of the humerus articulates in the shoulder, and the patella is a part of the knee. Which of the following structures is a type of synovial fluid sac between bones and overlying tissues? A. Ligament. B. Tendon. C. Bursa. D. Capsule. The answer is C. Bursa. Bursae are synovial fluid sac between bones and overlying tissues. They provide a cushion between the bone and tendons or musculature around them, allowing for reduced friction and painless movement. A tendon is a connective tissue point of attachment of muscle to bone, while a ligament is a connective tissue attachment from bone to bone. A capsule is a fibrous, Fluid-filled structure surrounding a synovial joint. Individuals who grind their teeth are at risk of causing damage to which of the following joints? A. The temporomandibular joint. B. The xiphisternal joint. C. The pisotrichtal joint. D. The intermetacarpal joint. The answer is A. The temporomandibular joint. Bruxism, or involuntary tooth grinding, can cause inflammation and damage in the temporomandibular joint, which is the articulation between the condyle of the mandible and the temporal bone. The xiphisternal joint is between the xiphoid process and the body of the sternum. The intermetacarpal joints are formed between the metacarpal bones of the hand, and the pisotrichtal joint is between the pisiform and trichum of the wrist. Which of the following is a term for movement along a sagittal plane that decreases the angle between bones? A. Adduction. B. Abduction. C. Extension. D. Flexion. The answer is D. Flexion. Movement along a sagittal plane that decreases the angle between bones is flexion. This is in contrast to extension, which is movement along a sagittal plane that increases the angle between bones. Adduction is movement that pulls a structure toward the midline of the body, while abduction moves a structure away from midline. Which of the following joints is capable of circumduction? A. The sacroiliac joint. B. The elbow. C. The knee. D. The shoulder. The answer is D. The shoulder. Circumduction is movement that produces a circular motion with the distal end of a body part. True circumduction allows for a 360-degree range of movement. Of the joints listed, the only one capable of circumduction is the shoulder. Which of the following is an example of a condyloid joint? A. The metacarpophalangeal joints. B. The acromioclavicular joint. C. The humeroradial joint. D. The glenohumeral joint. The answer is A. The metacarpophalangeal joints. Condyloid joints are a form of synovial joint in which a condyle rests in an ovoid cavity. Of the joints listed, the only condyloid joint is the metacarpophalangeal joints, the joint of the most proximal knuckle. The acromioclavicular joint is a plane joint, while the glenohumeral and humeroradial joints are both ball and socket joints. The patella articulates with which of the following bones? A. The tibia and fibula. B. The tibia. C. The fibula. D. The femur. The answer is D. The femur. The only bone that the patella, or kneecap, articulates with is the femur, at the patellofemoral joint. The patella is a sesamoid bone, meaning it is fully embedded within a tendon. The patellar ligament joins the patella to the tibial tuberosity, but not the fibula. Which of the following are three structural classifications of joints? A. Synarthrosis, epiarthrosis, and diarthrosis. B. Condyloid, gliding, and hinge. C. Sutures, synsmosis, gomphosis. D. Fibrous, cartilaginous, and synovial. The answer is D. Fibrous, cartilaginous, and synovial. The structural classification of joints divides them according to the form of tissue that connects bones to each other. The three structural divisions of joints are fibrous, cartilaginous, and synovial. In contrast, synarthrosis, amphiarthrosis, and diarthrosis are all classifications of a joint's movement. Condyloid, gliding, and hinge joints are all types of synovial joints, while sutures, synsmosis, and gomphosis are all types of fibrous joints. Gomphosis joints are fibrous joints found between the dash A. Tooth and socket. B. Radius and the ulna. C. Skull bones. D. Tibia and fibula. The answer is A. Tooth and socket. Gomphosis joints are fibrous joints that attach the root of the tooth to the bony socket of the mandible or maxilla. Both the tibiofibular joint and the joint between the radius and ulna are synsmoses, while the joints between the bones of the skull are sutures. Dash type of joints make up the majority of the joints of the human body. A. Amphiarthrosis. B. Synarthrosis. C. Synovial. D. Fibrous. E. Cartilaginous. The answer is B. Synovial. The majority of joints of the human body are synovial joints. These joints are diarthrotic and include a synovial joint capsule that allows for greater freedom of movement. Examples include the fingers and the elbows, the knees, the temporomandibular joint, and the hips. Fibrous and cartilaginous joints, all of which are either synarthrotic or amphiarthrotic, are relatively less common. What nutrients are specifically needed for proper thyroid hormone production? A. Tyrosine, iodine, and selenium. B. Iodine and manganese. C. Methionine and magnesium. D. Iron, manganese, and biotin. The answer is A. Tyrosine, iodine, and selenium. The nutrients specifically required for thyroid hormone production are tyrosine, iodine, and selenium, in addition to zinc and several B vitamins. While magnesium, manganese, and methionine are all essential for metabolism and overall hormone production, they are not direct substrates or cofactors in the production of thyroid hormone. What is selenium's role in thyroid hormone production? A. Conversion of phenylalanine into tyrosine. B. Synthesis of T3. C. Conversion of T4 to T3. D. Synthesis of T4. The answer is C. Conversion of T4 to T3. Selenium is essential for conversion of T4 to T3. Deiodinase enzymes, which remove iodine from T4 during conversion into T3, are selenium dependent. Tyrosine and iodine are both required for synthesis of T4, and iron is the cofactor for conversion of phenylalanine into tyrosine. What role do tyrosine and iodine play in thyroid hormone, thyroxine, T4, and triiodothyronine, T3, production? A. Conversion of T4 to T3. B. Synthesis of T4. C. Conversion of phenylalanine into tyrosine. D. None of these. The answer is B. Synthesis of T4. Tyrosine and iodine are both precursors for synthesis of T4. Selenium is essential for conversion of T4 to T3, and iron is the cofactor for conversion of phenylalanine into tyrosine. What hormone is produced as a response to rising plasma calcium levels? A. Thyroid hormone. B. Calcitonin. C. Parathyroid hormone. D. Cortisol. The answer is B. Calcitonin. Calcitonin is produced by the parafollicular C cells of the thyroid as a response to elevated blood calcium levels. Calcitonin reduces plasma calcium by inhibiting osteoclast activity and stimulating osteoblasts to deposit more bone. Parathyroid hormone has the opposite effect. It acts to increase calcium levels when serum calcium decreases. While they may ultimately affect serum calcium levels, thyroid hormone and cortisol are not directly involved in calcium homeostasis. Which of the following hormones is produced in the anterior pituitary? A. Dopamine. B. Somatostatin. C. Gonadotropin-releasing hormone, GnRH. D. Thyroid-stimulating hormone, TSH. The answer is D. Thyroid-stimulating hormone, TSH. Thyroid-stimulating hormone, TSH, is produced in the anterior pituitary. Somatostatin, dopamine, and gonadotropin-releasing hormone are all hypothalamic hormones. Somatostatin is also secreted by the pancreas, and slows down digestive processes. To remember the hormones of the anterior pituitary, use the following mnemonic: flat peg, follicle-stimulating hormone, luteinizing hormone, adrenocorticotropic hormone, thyroid-stimulating hormone, prolactin, endorphins, growth hormone. Which of the following hormones is produced by the adrenal medulla? A. Calcitonin. B. Thyroid-stimulating hormone. C. Epinephrine. D. Antidiuretic hormone. E. Follicle-stimulating hormone. The answer is C. Epinephrine. Epinephrine is the only hormone of those listed that is produced by the adrenal medulla. The adrenal medulla is the center of the adrenal gland. Antidiuretic hormone is produced by the posterior pituitary. Calcitonin is produced by the thyroid. Thyroid-stimulating hormone is secreted from the anterior pituitary, as is follicle-stimulating hormone. Which of the following hormones promotes uterine contractility during and after childbirth? A. Oxytocin. B. Progesterone. C. Estrogen. D. Prolactin. E. Amylin. The answer is A. Oxytocin. Oxytocin is produced by the hypothalamus, and is released by the posterior pituitary. Women experience an increased level of oxytocin during labor, after birth, and while breastfeeding. It helps to increase uterine contractility, aiding in the delivery process and preventing hemorrhage after birth. Progesterone and estrogen are hormones released from the ovary. Estrogen has many effects on the body, one of which is the development of sex characteristics in females. Progesterone is important in regulation of the uterine lining. Prolactin is made by the anterior pituitary gland and functions in the production on breast milk. When blood calcium is low, the parathyroid glands release parathyroid hormone. In response, A. The intestines absorb more calcium from food. B. Calcium is released from the bone. C. The kidneys excrete less calcium into the urine. D. The kidneys absorb additional calcium that is filtered from the blood. E. All of these. The answer is E. All of these. All of these are correct effects of parathyroid hormone. The kidneys resorb calcium and, as a result, less is released into the urine. The intestines absorb additional calcium from food and calcium is released from the bone through the work of osteoclasts. The thyroid is regulated by thyroid-stimulating hormone. Thyroid-stimulating hormone is produced by which of the following? A. The posterior pituitary. B. The adrenal cortex. C. The adrenal medulla. D. The hypothalamus. E. The anterior pituitary. The answer is E. The anterior pituitary. Thyroid-stimulating hormone, TSH, is produced by the anterior pituitary. TSH causes the thyroid to release thyroid hormones, T3 and T4. A TSH blood test is often ordered to diagnose hypoactive thyroid. The nurse is counseling a patient who will return to the office for a serum aldosterone blood test. The nurse tells the patient that aldosterone levels are highest at what time? A. 11 a.m. B. 7 a.m. C. 2 p.m. D. 5 p.m. E. 11 p.m. The answer is B. 7 a.m. Aldosterone is a hormone secreted by the adrenal glands. Serum aldosterone levels vary throughout the day. Aldosterone presence is highest in the morning. Of the answer choices, 7 a.m. is the best choice. A physician may have the patient came to the office at a specific time of day for this reason. The pineal gland is located in the center of the brain. Which of the following hormones is the pineal gland responsible for regulating? A. Vasopressin. B. Melatonin. C. Vitamin D. D. Leptin. E. Cortisol. The answer is B. Melatonin. The pineal gland is responsible for regulating melatonin. It is not known at this time to secrete any other hormone. Melatonin is thought to play a critical role in the regulation of the circadian rhythm. Cortisol is secreted by the adrenal cortex and is involved in regulating the stress response. Vitamin D become activated in 3 steps. First, ultraviolet light in the skin begins the process, then the process continues in the liver, and is completed in the kidney. The active form of vitamin D increases calcium absorption in the gut, decreases calcium loss in urine, and increases calcium mobilization from bone. Vasopressin is also known as antidiuretic hormone, and functions in water retention. Leptin is a hormone secreted by adipose tissue that tells the body that it is full, and not hungry. Which of the following are not considered endocrine glands? A. The hypothalamus. B. The pancreas. C. The thyroid. D. The testes. E. The salivary glands. The answer is E. The salivary glands. Endocrine glands secrete hormones into the blood. The endocrine glands include the ovaries, testes, hypothalamus, thyroid, pituitary, adrenal glands, pancreas, the pineal gland, and others. Salivary glands are considered exocrine glands. Exocrine glands secrete substances through ducts to the body surface or into body cavities, such as the mouth in the case of salivary glands. Catecholamines are hormones that are released into the blood in response to stress. Where in the body are catecholamines produced? A. The thyroid gland. B. The adrenal cortex. C. The adrenal medulla. D. The parathyroid gland. E. The anterior pituitary gland. The answer is C. The adrenal medulla. Catecholamines are hormones produced by the adrenal medulla. Adrenal glands are located above each kidney. Catecholamines may also function as neurotransmitters, important chemical messengers. They regulate the sympathetic nervous system's response to stress. The pancreas produces many hormones that are vital to body function. Which of the following is not produced by the pancreas? A. Insulin. B. Glucagon. C. Calcitonin. D. Somatostatin. E. Lipase. The answer is C. Calcitonin. Calcitonin is produced by the parathyroid gland. The hormone plays an important role in lowering blood calcium levels. It is also synthesized as a drug and used in the treatment of hypercalcemia. The other three hormones are indeed secreted by the islets of Langerhans in the pancreas. Insulin, secreted by the beta cells, lowers blood sugar. Glucagon, secreted by the alpha cells, increases blood sugar, and somatostatin, secreted by the gamma cells, regulates digestive and metabolic processes. Lipase is not a hormone, but an enzyme that facilitates the breakdown of lipids. The pancreas does indeed secrete lipase. Which of the following regarding the thyroid gland is false? A. T3 is more potent than T4. B. The thyroid releases hormones in response to hormones secreted by the anterior pituitary. C. Calcitonin is released by the thyroid. D. The thyroid gland is located posterior to the trachea. E. The thyroid gland produces more T4 than T3. The answer is D. The thyroid gland is located posterior to the trachea. The thyroid gland is located, in front, anterior to the trachea. The parathyroid glands are located on the backside on the thyroid. The thyroid is stimulated in response to TSH produced by the anterior pituitary. It will then secrete T3 and T4, although T3 is more potent and produced in a lesser quantity. Calcitonin, a hormone which decreases blood calcium levels, is also produced by the thyroid. Which of the following hormones causes a feeling of satiety? A. Insulin. B. Growth hormone. C. Leptin. D. Cortisol. The answer is C. Leptin. Leptin is secreted by adipose cells, and acts on the arcuate nucleus of the lateral hypothalamus to promote the synthesis of alpha-MSH, alpha-melanocyte-stimulating hormone, which is a hunger suppressant. It also binds to receptors for neuropeptide Y, NPY, a powerful hunger promoter, in the arcuate nucleus. None of the other hormones listed, while all involved in nutrient and blood sugar metabolism, directly trigger feeling of satiety. Which of the following will cause a decrease in leptin levels? A. Exercise. B. High testosterone. C. Sleep deprivation. D. All of these are correct. The answer is D. All of these are correct. Leptin, the hormone responsible for feelings of satiety, goes down during times of fasting, with high testosterone, during sleep deprivation, and during periods of prolonged exercise or physical training. Which of the following will cause a decrease in leptin levels? A. Exercise. B. High testosterone. C. Sleep deprivation. D. All of these are correct. The answer is D. All of these are correct. Leptin, the hormone responsible for feelings of satiety, goes down during times of fasting, with high testosterone, during sleep deprivation, and during periods of prolonged exercise or physical training. Which of the following is the primary immunoglobulin secreted into the intestinal lining and mucous membranes of the respiratory tract? A. Ig. B. Ig. C. Im. D. Ig. The answer is B. Ig. Ig, primarily in its secretory form, S-Ig, is the most abundant immunoglobulin in the lining of the gastrointestinal tract and in the mucous membranes of the respiratory tract. It is also present in the urogenital tract, in tears, in saliva, and in breast milk. All of the other immunoglobulins may be present in mucous membranes, depending on the presence of active infection or allergy, but none is as abundant in secretions as Ig. Ig is primarily involved in binding allergens and inducing the allergic response via release of histamine. Im is expressed on the surface of B cells and is the first immunoglobulin to fight pathogens at the site of infection, injury. Ig are the most abundant antibody throughout the body and play the largest role in fighting pathogens. Ig can cross the placenta and thus confer passive immunity to the fetus. The presence of which of the following cytomegalovirus, CMV, antibodies would suggest an active CMV infection? A. CMV-IM. B. CMV-Ig. C. CMV-Ig. D. CMV-Ig. The answer is A. CMV-IM. The presence of CMV-IM would suggest an active cytomegalovirus infection, as IM is the immunoglobulin released during the initial, active infection with a pathogen. The presence of Ig would suggest a past infection, where Ig specific to the virus would be present as part of adaptive immunity, ready to respond to the virus should the host ever be re-exposed. Ig is not formed when an individual contracts CMV, as Ig is produced in response to allergens rather than pathogens, except parasites. The function of Ig is thought to be related to the allergic response by regulating basophils and mast cells. Which of the following is the only immunoglobulin capable of crossing the placenta and conferring passive immunity to a fetus? A. Ig. B. Ig. C. Im. D. Ig. The answer is B. Ig. The only immunoglobulin that has been shown to be able to cross the placenta is Ig. This is important in that it confers short-term immunity to the fetus that continues into the first few months of the infant's life. Note that it is common to give Rh-negative anti-Rh injections at about 28 weeks gestation. A booster may also be given at about 34 weeks gestation. Which cells of the pancreas produce insulin? A. Gamma cells. B. Alpha cells. C. Delta cells. D. Beta cells. The answer is D. Beta cells. Insulin is produced by beta cells of the pancreatic islets. Insulin's action is to decrease blood glucose, facilitating its uptake into cells. Alpha cells produce glucagon, which has the opposite effect as insulin. Delta cells produce somatostatin, which inhibits many digestive processes. And gamma cells produce pancreatic polypeptide, which regulate pancreatic secretion. Where in the human body is the pituitary located? A. In the brainstem. B. Attached to the pancreas. C. Behind the thyroid. D. Under the hypothalamus. E. Above the kidneys. The answer is D. Under the hypothalamus. The pituitary is located just below the hypothalamus. The pituitary and the hypothalamus are connected by nerves and maintain an important working relationship with one another. Both are located near the base of the brain. Which of the following cytokines acts as a chemoattractant for neutrophils? A. Interleukin 8. B. Tumor necrosis factor alpha. C. Interleukin 1. D. Interleukin 6. The answer is A. Interleukin 8. Interleukins, IL, are cytokines that play a role in signaling the immune cells. IL-8 is produced mainly by macrophage and dendritic cells and plays a major role in inflammation as a chemoattractant for neutrophils. IL-1 and IL-6 both induce acute phase proteins. TNF-alpha is involved in the acute phase reaction. It is an endogenous pyrogen, meaning it induces fever, and is also involved in apoptosis and tumor inhibition. What antibacterial proteins are contained in tears? A. Lysozymes. B. Catalycidin. C. DIFA1. D. Defensin 5. The answer is A. Lysozymes. Lysozymes are a group of defense enzymes found in tears, saliva, mucus, and breast milk. It is considered part of our innate immune systems, as its presence in tears prevents infectious conjunctivitis. Catalycidin, defensin 5, and DIFA1 are found in the lysosomes of polymorphonuclear leukocytes, PMNs, and macrophages. All of the following cells express major histocompatibility complex 1, MHC1, except dash. A. Hepatic cells. B. Epithelial cells. C. Neutrophils. D. Red blood cells. The answer is D. Red blood cells. Major histocompatibility complex 1 in a membrane protein that binds to peptide fragments from pathogens such as viruses and bacteria and then displays them on the cell surface in order to alert other immune cells of the presence and nature of infection. All cells with nuclei express MHC1. Red blood cells do not have nuclei, and do not express MHC1 on membranes. Which of the following cells produce antibodies? A. Natural killer cells. B. T cells. C. B cells. D. All of these. The answer is C. B cells. Antibodies are only produced by B cells, specifically by a type of specialized B cell called a plasma cell. B cells belong to a broader category of leukocytes known as lymphocytes, which are granulocytes. In what tissue do T lymphocytes mature? A. The bone marrow. B. The thymus. C. The spleen. D. The liver. The answer is B. The thymus. T lymphocytes are so titled because they mature in the thymus, unlike B lymphocytes, which mature in the bone marrow. The thymus is located in the anterior superior mediastinum, ventral to the heart and dorsal to the sternum. It is most active in the neonatal and pre-adolescent periods. Afterwards, it degenerates and is replaced with adipose tissue.